Hey, so I'm Chase Sayre. Currently, by profession and trade, I am a clinical social worker. So I work with people with several mental health issues, anxiety, depression, addiction, and any other struggles like that. In working in this field, I thought I've studied the human behavior sciences for several years now, 8 years. Like I feel like I can pretty control of myself, can help lots of people, things like that, until something pretty tragic happened in my life where the love of my life, my dear wife, decided for her best interest she felt like she needed to leave. Uh, and and at first I was handling well. I was like, okay, you gotta leave, you gotta leave, you gotta take care of you, and I love and respect you, so go do that. But then after that, there's some grief, loss, self-doubt, pity, compulsions, so on, just entered in my life in a very powerful way. And I was like, okay, well, some skills, take care of it. I used all the skills that I knew, all of the therapeutic practices that I've been a part of on myself, and using those things, I was like, I can't get over it. Went to a therapist, practicing the modalities and models that I believed in, that I subscribed to, that I knew would be in my best interest, and started seeing a little bit of results. But it was more like I feel good until next week where I have to come again. So just like, it was almost like a drug. Like I had to like take it just long enough to feel good, just long enough, literally not to kill myself, long enough to just get by and say, okay, you got this, get through another day. And I was like, I don't want to live my life like this, just trying to get by. And so I kept looking for more. And I had a dear friend who worked with Bob, and I was like, all right, you said you have some results, but let's be honest, coaches are quacks. And we had to talk about it. I was like, I'm willing to try a quack, but I want to know how much of a quack he really is. Like, clearly you have results and I don't, going about the modalities that I believe in, so I want something. And so I asked the questions, and I treated it as if it was a bunch of a hogwash. But then I went to the event and realized, at least for Bob's got some things figured out. He was using stuff that was familiar in my field, but practiced in a language that was unfamiliar to my field, which I think is helpful, because how many times does somebody know words like narrative therapy, EMDR, know all these abstract theoretical concepts like attachment theory or Bowlby's theory, or like all these things that are just people don't care about? Why not use normal language, which is what Bob does really well with coaching? And I could tie it in all these fancy concepts that he uses, but that's really irrelevant for a person going through the situation. I didn't care when I was going through it. But for me, working through years of my own stuff, a year of my own stuff, and probably a year of another therapist trying to help me, and having very minimal results, to work with Bob for 3 days, and all of a sudden I could think of my ex-wife and realize, wow, I love her, but I don't have to be in pain by that. 3 days, like that was like blown away that some quack could give me results in 3 days. And so, and honestly, he used therapeutic practices, but melded it in such a way and made it so practical that it was real for me. I mean, a simple example is, in our field, we describe this concept called experiential learning, that you're most likely going to learn it if you've experienced it physically and gone through it. And it's like some crazy high number of 80 to 90% of our learning happens this way. But as a therapist, how often have you had an experience with them other than sitting down in your depressed position that you always sit in? So there's these key ingredients that we're taught in our field, but we have some limitations in our field. And then another key example that I would like to use of that's huge, that's been really powerful with coaching, is, if you look at it, the number one success factors in any therapeutic context are taught to be the relationship you have with your client and their belief in the therapeutic practice. So it really has nothing to do with the therapist at all. It really has to do with the relationships. And coaching provides a really good context to create relationships that therapies doesn't, honestly. And your belief in the modality, ask Bob some questions. See if there's some belief around that. To me, it made sense. Your body is a key component to a lot of your mental illness, and to have some experiential learning in the context of your body with some mental health concepts made perfect sense in a theoretical practice. But as a therapist, we can't do some of those physical experiential pieces that were very critical for me, honestly, in my healing.